The reason most people do planks ineffectively is because the plank exercise is about compression of joints. Most people don't realize that at least one of their joints is probably living in a decompressed state. Abdominal muscles, the abs, the six-pack abs, the rectus abdominis, the internal obliques, the transverse abdominis, they cannot work appropriately when a joint is in a decompressed state because that puts a spine into extension. A lot of people think they are doing a plank in a neutral spine. However, they're really doing it in an extended spine position on one side or both sides, and that's what this video is about. As I stated in previous videos, the idea that a spine can be neutral is probably a myth. The moment you speak, right now my spine cannot be neutral because as I'm speaking, my vocal cords, which rest right upon the spine, are vibrating the spine. The moment you take a breath in, your ribs move, which moves your spine. Your heart beating, things that are pumping through your body will vibrate and move your spine. So even if it's very small amounts of movement. So the idea that you're going to have a neutral spine position is probably not really the reality of the situation. Plus, you're not symmetric. And the forces on the right side of the spine and the left side of the spine are not the same because of the bigger right diaphragm and the smaller left diaphragm. So how on earth can an asymmetrically designed, speaking, breathing human ever have a spine that's in a neutral position? Now, again, it depends on what your definition of neutral is, but in the strength conditioning and physical therapy world, they're generally talking about a spine being in neutral, as in the middle. Well, the middle, where is the middle on an asymmetric system? That's besides the point. I've already talked about that. I'm going to move on from that subject. The second half of this video is an interview with Molly Miller-Rose, who's a physical therapist, a Postural Restoration Institute credentialed physical therapist in North Carolina, who deals a lot with the hypermobile population. Now, hypermobility is a soft tissue disorder which leads to many physical and physiological issues, but it's on a continuum of what we in PRI call pathology, meaning when joints are a little bit too unstable. So where we get instability most often is in the front of the left hip. I would say 95% of people that come to see me, maybe 95, have some instability in their left hip, and that's one of the reasons why they're actually in pain. So that created pathology, that instability in the left hip, it's on a continuum with hypermobility. Now again, hypermobility is a diagnosable soft tissue disorder, which is way worse than just having pathology. But they're not that dissimilar. So even in the interview, even if you're not hypermobile, and we're really just talking, in the interview it's about hypermobility, but it's really about pressure and joints and the need for the brain to sense pressure through the joints and pressure from the ground. My whole story is one of decompression, of the mismanagement of internal pressures in my cranium, in my thorax, in my pelvis, and from under the ground, because it was a sensory issue. My jaw was in the wrong spot. My head was, obviously, you can see in the picture, I'm all over the place. That was a pressure management issue, and as Molly says, we have to manage pressures. Breathing is the management of pressure. Chewing is the management of pressure. Walking is the management of pressure, heel, arch, big toe. If you're stuck over on one side because of human asymmetry, your pressure exchanges are not occurring in a balanced way. They'll never be perfectly symmetrical because we're not symmetrical. However, they have to be in a certain norm, in a certain range of asymmetry. You'll be fine. So postural restoration is seeking to restore that normal range of asymmetry. So if you're doing a plank exercise and you think you're doing it for your abs, but you can't pass simple shoulder internal rotation test, or you can't pass simple adduction tests of the legs, which are indicating a pelvis that is stuck forward on one or both sides, or a rib cage that is flared. You might see a rib flare on one side or even on both sides. Those are signs, the tests and the rib flare, especially if it's on both sides, that is decompression. You are not managing compression inside your own body, and thus you're probably not managing pressure from the ground up, both of which are needed to have a fully normal pumping system. Craniums have to pump. It's called the tide. It pumps fluids. It pumps air. The thorax has to pump, but that can only pump if the diaphragms pump. The pelvic floor has to pump. All of these systems, fluids and air, remember that's what we have to pump, and these things have to circulate, and blood, obviously. When that pumping system breaks down, our normal human physiologic function becomes less stable. We become less integrated as humans. Our bodies become less integrated. Our neural networks in our brain become less integrated, and we become more unstable, definitely in the body, Probably it's going to reflect it in your psychology as well. And I talk about it in the interview as a cheesecake issue that you have. If I refer to pathologic or hypermobile people in this cheesecake analogy, don't take it personally. It's just a way to think of it. I was the cheesecake, the sliced up cheesecake. That's where I was in so much pain for so much of my life. That's why my ear started to ring when I was 13 years old. That's why my skin was constantly breaking out from teenage years up until maybe 2 years ago. Now I barely break out at all, which was histamine intolerance. All these weird things that you can get, that hypermobile people are constantly being diagnosed with. That can happen with people who are simply decompressed in the left hip joint, which is completely normal. Once you become decompressed and the pumping stops and flow ceases, not ceases, but is not as efficient as it used to be, digestion can start to be impacted. You can start to have all sorts of weird autonomic nervous system issues. So when your body is in an extended position, meaning your pelvis is forward on one or both sides and your rib cage is up on one or both sides, that means you're in a state of spinal extension. Again, the majority of people, if you're no longer a teenager, and if you're a big-time exerciser and weightlifter, you're definitely living in some state of spinal extension. You're not going to find that neutral spine. Again, if you can't pass these tests that I showed previously, you're not in a neutral position, whatever that neutral. In the PRI, it just simply means you're not oriented to the right, because right-dominant humans, when they're not in a more middle position, they're oriented to the right. They're not going to be oriented to the non-dominant side. So when I say neutral, it simply means you're kind of you're no longer oriented to the right. You can pass your test. Your spine is still moving with every breath you take, with every word you pronounce. So I'm not saying your neutral spine is found in the middle. It just means your body is not stuck over to the right side. If you're in an extended spine position, your hip joints and your shoulder joints are going to be in a decompressed state. Your scapulas, or your legs, are not going to be sitting. When the pelvis comes forward on one or both sides, that femur is going to have to externally rotate to stay straight, and you will decompress the hip joint. The same thing is going to happen up with the scapulas and the shoulder blades. As the spine extends, the spine moves away from the scapulas, which produces this winging effect. So your brain will not sense compression of your scapulas on your rib cage, and your brain will know it because nerves transmit pressure sense. That's what our brain works off of: frequencies and pressure sense and temperature, but that's not usually the issue. Touch, pressure, that's what our brain, that's what our hands, our feet, our limbs, that's what our brain transmitted through those structures is what our brain is responding to. When you're extended, because of this mispositioned pelvis and femurs and arms and scapulas, it's no longer getting that pressure sense. And what do? You tighten up. So tension, when you extend and your spine extends because you're in this position, your abs lengthen. If you do a plank in that position, you're just strengthening your abs in a lengthened position, which just further solidifies the postural dysfunction. So the key is flexion. But just real quickly, and that's what you're going to see with the techniques that are demonstrated at the end, is a plank in flexion, but also a compressed state. Let's put it that way. A plank in a compressed state, which will then inhibit overactivity of the back so the abs can turn on. A plank is not facilitatory, if that's the right word. Abdominals will work when your back and your brain and your body relax and you're no longer in an extended state. It's not about activating the abs. It's about inhibiting the inappropriate tension. So these images are from the book Why Structures Don't Fall Down. And you see in this picture distribution of compressive forces. If the compressive forces are right in the middle, everything is evenly distributed. This is how most humans think they are. And this is what physical therapists often assume, and doctors assume, that you're a symmetric human. You're not. Again, bigger right diaphragm, brain function, not symmetrical. Our sensory systems, our visual systems, our auditory systems are not symmetrical. They don't act the same way on both sides. And this is all in the neuroscience literature. So if you want to understand these situations, you can't do strength and conditioning to understand this. You can't be a personal trainer to understand. They're not going to teach you this stuff. I didn't know it. I had to go into postural restoration and then find all the research in the neuroscience areas of science. You are not symmetrical. Your right eye and left eye will not act the same way. Your left and right ear are different. They have different pathways in the brain. They're paying attention to different things. The hemispheres of the brain pay attention more to the right than to the left. And it's all in the, I've talked about this a million times. Anyway, you do not exist. This person, that picture would not relate to you, and nor me, nor anyone else, because we are not symmetrical. Now here would be a normal, this is how humans are. That line is off to the right. So the distribution of compressive forces across AB, and you can just read it in the bottom of the picture, is not equal. It never will be, but that's not the issue. The issue becomes when that arrow starts to move further to the right, because we become, this is my right, I'm not going to match the orientation. This is my right. Right now, as I sit here, to my brain, I'm on my right side. I might look centered, but because of asymmetry, I'm not really on the right. I'm not really middle. I'm more to the right because of this asymmetry in brain function. Now here I'm more to the right. That's when you start to see right shoulders drop, left shoulders go higher, heads start to tilt quite a bit. All right, that's still a normal pattern. I don't worry about that. People will feel their right molars more than their left. Again, normal pattern. I don't worry about that. When it goes too far to the right, now you see where that CB letters are. You start to actually decompress through that left hip because everything is being so weighted down on the right side. You've been sitting too much at a computer. You're not outside enough. You're too stressed. Whenever you're too stressed and you're not stop moving and your brain doesn't get signals of movement and you're too static and staring at computers and screens, you go to your right side. If I make you listen to music you don't like, you will go to the right side. I've made videos of this. Anything that threatens you, you will go to your dominant right side. That's just how we are because we have a dominant side. That's not, having a dominant side, remember, having a dominant right side is not the issue. Overdominance of that overdominant right side becomes the problem. And as you drift further and further to the right and you never balance it out by fully going to the left side, that's where we start to become pathological in the front hip. And I talk about this with Molly in the video. That's completely normal. Again, that's not too problematic, but there's degrees of that. But then you can start to also get that type of instability in the lower back on the right side. It can very common in the left shoulder. So you can start to get pathology like that, over time as you get stuck too far to the right and you try to move forward in life and breathe and lift weights all in this rightward position. You start to stretch structures out to try to get range of motion that you can't get. Now the hypermobile person is already living like that. They're born like that. It wasn't created, and that's a point that we make in the interview. And eventually you get so far to the right that everything just starts to fall apart. You're going to start to fall. You're going to get clumsy. You're going to start to pull in a right canine, you're going to start to overuse a right eye. Your prescription will start to change. You're going to do whatever your brain will do. You're going to have a really overactive right neck. You're going to have a really overactive left lower back. Your brain is going to overuse something to try to keep you upright to prevent you from falling further. And that's where things get more complicated, especially when jaws start to shift. You see it a lot. Teeth start to get pushed out. Tongues start to thrust, and they start to create open bites. But we don't talk about that. That's what this channel is about. So that's where things get really difficult. And that's kind of where a hypermobile person is already existing because they're so unstable. It's built into them. Remember, it's a connective tissue disorder. But even if you're not hypermobile, remember, a little bit of this is going to go into you because you are an asymmetrical human. And yeah, your left hip will probably become unstable over time, just really because of the demands of modern life, which do everything it can do to make us less human by putting us in front of computers and having us not move and stare at things and have hands here when they should really be out here. And you have networks in your brain that are devoted to only paying attention to what your hands are doing and where they are in relation to your face and your body. Here, your brain doesn't really know where you are anymore. Oh, now I know where you are. Hands give boundaries. Remember, your brain has to guess where you are. It has to figure it out. Your brain is just billions of neurons linked up in billions of different ways. How does it know? Well, they can't really say how they know. They just can see how things work out with brain imaging, and they can take people who have brain issues, like the two hemispheres of the brain had to be cut, and or they have a stroke on one side, and they find out what that person can or cannot do. So through research, they figure out what the brain does. Hands are a big deal. That's how your brain figures out where you are. When you're walking, the hand should rise up into your bottom field of vision. If you're on a computer too much, computer people are notorious for walking with their arms just at their side. There's no arm swing at all. They don't rotate. And as they don't rotate, As their body doesn't rotate, but they need to rotate and move forward, they start to use their neck, their hip flexors, their lower back, and they force ranges of motion and they start to get stretched out. I quite often talk about unstable left hips, which we call pathology. It was something that was created because you got restriction, because your pelvis, let's say, was stuck over on the right. Your left leg would be facing this way, and it had to externally rotate to stay straight so you could walk forward. And as you do that, maybe you play sports and you're creating more power and more push, you start to stretch out the front of that hip capsule, the ligaments, to get that range of motion that you can't get. But in the process of getting that illegal range of motion, you now create instability that has to be covered up somewhere else by tensing up somewhere else to cover up for that instability. Exactly. So that would be pathology. Now it can happen in shoulders and hips, in necks. It can happen anywhere, and that's going to put tension levels up. So how would you? Do you think there is a corollary, or are they somewhat? Now, of course, how similar are they?
Yeah. Let's say this, like someone with a pathology, like for instance, an ankle that's been sprained like 6 times and the ligaments stretched out, or the front of the left hip, their connective tissue is pathological just there.
Yeah.
And you can still treat them and assume that they're using a pattern of autonomic tension in a PRI pattern. People with hypermobility, even if you were to restore that joint to a non-pathological position, which is what we strive to do, they would still have instability. So they're very similar in that the body reacts the same way. Like the autonomic nervous system doesn't discriminate. It's going to react in the same way, no matter what's causing that instability.
So it's more about localized instability versus systemic.
Yes.
Okay. And then systemic could possibly lead to even more localized.
Oh yeah, hands down.
Because these people are still going to move, most likely.
Yeah.
They still might play sports. They might do something that requires extra effort that could then start to stretch out whatever unstable structures they already have.
They might overstretch their hip flexors and their hamstrings. They sometimes don't know that they're hypermobile, number one. And they come in with kind of like a host of symptoms that seem really unrelated. So the challenge, I guess, for me as a practitioner is that the hypermobile, like connective tissue, affects all the symptoms of their body. And no one's told them that hypermobility could be like an underlying explanation or rationale for that. So just having them know that having hypermobile connective tissue, whether you have Ehlers-Danlos or not, that can be associated with other systemic issues that they've had to go to several doctors for and been told that, they need to just go on a vacation or decrease their stress because there's no explanation for their pain.
Right.
But the reason that they are so different in terms of like presentation is their lack of they can't regulate internal pressure.
And they have 2 different types of cheesecakes. They have a cheesecake that's whole and a cheesecake that's pre-sliced. Now, it's the same cheesecake.
Yeah.
One is pre-sliced and one is whole. Now, you're still whole, but the patho person or the hypermobile person, they get disconnected in the sense that whole cheesecake, they're still one body, but they become segmented. And it's like there's no integration of that body or brain in a way. And they become that sliced cheesecake. And everything becomes separate.
They're so confused because they're separate. They're not connected.
Yeah. And so underneath, there's still the cheesecake, the full whole cheesecake pre-sliced, but obviously unsliced. But then you turn in, and this is how I've always thought of pathology rather than hypermobility, actually, because I wasn't thinking about those terms. I was thinking about pathology. And
Totally.
the more pathologic you become, the more you become a pre-sliced cheesecake. And now, one slice is a left leg, another slice is a right arm, and they're not
Mhm.
connected anymore. And then it can get worse and worse and worse from there. And then the whole body, because when you watch them walk as a dance teacher and someone who's got, pretty good rhythm skills, I can see those limbs are not swinging together.
They're not alternating
It's
at
just
all.
it's just a random collection of limbs at that point. So that's what I was always, and I think once you're cranially driven, you are that pre-sliced cheesecake, and you have to be put back together, but you can't
Yep.
get put back together without the appropriate sensory inputs.
It's like when they are both, they can be like overstimulated and understimulated at the same time. So it's like, because they have lack of interoception and proprioception, they're like sensory seeking,
Mhm.
but then it gets to a point where they like hit this threshold and suddenly they're overstimulated,
Mhm.
and that's when they shut down. The way that I describe it is like your pelvic floor and your diaphragm and your vocal folds are supposed to pump, alternate, and pull in and push out air for your postural stability. And the rest of all of the muscles around that trunk and pelvis and cranium are just supposed to allow you to do that
Mhm.
while you alternate. If you have hypermobile connective tissue, chances are you're going to go into the extremes in order to find sensation. And so you lose this nice, like connected and integrated pump that would have otherwise helped you hold yourself up.
Okay.
So their joints go into hyperextension, like, you lock out your knees, your hips go forward, your back arches, you round, their rib cages collapse, and they're hanging out on the end, like the end range of their ligaments.
So would you say they're using their pelvic floor muscles, their diaphragms, and their vocal cords or their larynx area
Yep,
to help support them posturally,
absolutely.
which then decreases their ability to actually use them the way nature intended, which was to pump?
Exactly.
Okay.
So their postural muscles become, like, their respiratory muscles become postural muscles,
Mm.
and therefore their postural muscles have to become respiratory muscles. So their neck and their back and their arms and their feet are all now helping them push and pull air in and out when that's not, it's supposed to be easy.
It's supposed to be, yes, it's supposed to be easy. So, and the posture that creates is what we call extension.
Mm-hmm.
The longer you're in that position, in that extension pattern, the more unstable you become because
Absolutely.
you're in this compromised position. Is how would you get them started? Is there a best position? If it's a
Mm.
PRI technique, something like that, um, what would be the best position? Now, again, everyone's individual.
Yeah.
Let's just say the average person, nothing going on in the cranium, let's say,
Mm-hmm.
where would you probably start them?
So after, let's just say after a lot of education about what we just talked about, right? Their need for the ground, their need for safety, um, avoiding too much inhibition, right? If we can assume that their wrists and their ankles are unstable and their hips and their shoulder joints are unstable, we want to provide a sense of pressure at the joint, like specifically the ball and socket joints, the shoulder and the hip, from a gravitational standpoint. So an all four position on forearms
Yeah.
is better for someone than being on wrist, because the wrists get unstable and then they lock out and hyperextend their elbows. So I call that puppy pose. But what it does, it's sort of giving them the sense of push from the ground. Like their socket is resting on the ball of their femur and they're experiencing the weight of themselves onto the femur, which is a stabilizing, like in that position, it's stable, right? And then again, instead of maximally rounding, they learn to breathe in that position.
Are they minimally rounding?
I honestly just say like whatever your breath is doing, like maybe allow breath to come into the back, right? The back area. But a lot of times if you have them stay there long enough, air will come into the back anyways, because in that position of being on the forearms, the hamstrings are sort of put on, the hamstrings have to work. So it's almost like a repositioning technique. Supine, while it's a great position because it's resting, a lot of times supine will just cause like rectus dominant and neck dominant stability. And the 90-90 position is too unstable. Like they don't have enough sense. They don't have the ground yet. So to ask them to use the ground to reposition their hamstrings, like on the wall being the ground.
To reposition their pelvis using their hamstrings.
Yeah, for them to reposition a pelvis using their hamstrings with their feet on the wall ground, they don't even have the sense of the ground to begin with. So the puppy pose or all fours on forearms provides pressure sense. Now, the hardest thing about this one, I say, is that you put them in it and they don't feel anything at all.
Right.
And I'm like, good. Just stay there. Just stay there and breathe, because again, their brain is like searching for some kind of information, be it pain, stretch, tension, pressure. Like their brain is like searching for something to be vigilant of, like what's happening. But really, we're trying to help their autonomic kind of unconscious system just sense and integrate pressure at the joint, like the approximation of the joints. So they really don't have to do much except for breathe there.
Right. Now, for the person who might be all or nothing, still in their blood, so to speak,
Yes.
they might be like, this can't be doing anything.
Oh yeah, that's why they hate it, right? Because their personality, their nervous system is their personality, and they're like, I have to work hard in order for it to count, because their body is working hard every single day just to hold themselves up. So they're like, it doesn't count if I'm not like pushing it and stretching all the way.
Right. Okay, so this is the puppy pose that we were talking about in the video. And you'll see, because of the position, Molly's elbows are pushing down into the floor as she pushes gently her spine up towards the ceiling, which is putting her, now in the video, she said she doesn't really have people, this population, round their back too much. Just get in the position and breathe. It's posteriorly tilting the pelvis, so the hamstrings will be engaged, even though you probably won't feel them. The knees are pushing down into the floor, so your brain is getting compression sense, or sense of pressure, through the elbows and through the knees and into the hip joints. So the back is a little bit rounded, so the diaphragms can start to pump again, so the back can expand with air, so that to take you from a state of extension, spinal extension, into a state of what we would call euphemistically neutrality, which we know doesn't exist. It just simply means not extended. Now, in a plank position, this is me, I'm kind of doing it wrong. I'm not going to say it wrong. I'm going to say I'm doing a plank how people would normally do it, even when they think they're doing it with the neutral spine. They're probably in extension, at least a little bit. So there's no pumping going on. And the problem is your pelvis and your ribcage are being pulled apart, which means your abs, which you ostensibly are working, are working in a lengthened state, which means you're just solidifying this extended state. We got to get you, there's not going to be any compression felt through the hip joints, which would be difficult anyway, but nor in the shoulder blades. And without that shoulder blade scapular on spine compression sense, your spine is going to stay tight, and you're likely overusing your neck in that situation. That's why so many people feel their lower back or their neck when they're trying to do planks. It's because they're just planking in an extended state and there's no compression going on. Thus, you continue to use your respiratory muscles as postural muscles and your postural muscles as respiratory muscles, which is not what we want. Now, here would be a plank in a flexed compression state. My back is round. I am rounding my back in this position. I can feel my abdominal. The reason I feel my abdominals, though, is not because I'm working my abdominals. I am working my abdominals, but it's because I've inhibited inappropriate tension, inappropriate activity, and I am breathing. You do not want to hold your breath. That will not work. For our purposes, that's just putting you into a fight or flight state. Breath holding is threat. Don't do that. That's pointless. Intra-abdominal pressure in a plank makes no sense because you're never going to be holding your breath as you are going through life. You're breathing. So why strengthen yourself in a position that you're really never going to be in unless you're lifting? Now, if you're planking because you want to increase your squat and your deadlift because you're a power lifter, well, that's one thing. But you better be able to do a plank while you're breathing also. Otherwise, you're going to be living in that situation, which is going to make you feel like not so great over time. So you need to regulate that pressure appropriately, which takes pumping, which requires diaphragmatic breathing, which requires breathing. Otherwise, you're just going to stay in that tense state, and remember, it's fake stability. I think that's all I really wanted to cover. But your abs in this position will be felt working when your brain senses the appropriate compression, your back is relaxed, and you are breathing. Don't hold your breath. In through your nose, out through your mouth. Inhale through your nose. Try to get air into your back. Exhale all the air. Get all the air out. Pause a couple seconds. Breathe in again. I would also add, because the tendency to hyper-focus your eyes when you do stuff like this, try to keep your eyes relaxed and maintain a wide peripheral view. You might start to shake a little bit. A lot of people will fixate their eyes to help stabilize them, as they may also hold the breath. Both of those are physiological, neurological states of fear. Kind of pointless. You're trying to get out of a fearful state. I would never train anyone I would never train someone to be although when I was a strength and conditioning coach, I probably was, unfortunately, teaching them to be fearful, or at least do exercises in a fearful state, simply because that's how we're taught. Big breath in. And the staring part I never realized until past 6 or 7 years, but the breath thing, big. So so this is what you would want to do. This is a flexion, pumping, compressive plank, and it will work a lot better in the long run.